Hi, this is Dr. Paul from Amara Aesthetics, and today's video I'll be talking about the different advanced areas of Botox. So the standard areas of Botox are in between the eyebrows for frown lines, across the forehead for worry lines, and around the eyes for smile lines. They're the three main areas that every doctor kind of gets trained in when they first learn about doing Botox. There are a few advanced areas that not everybody does, and I'm just going to go over those really quickly. And the first of those is the brow lift, where you get between 1 and 5 injections around this area here. The purpose of that is to lift the eyebrows slightly. Now, everybody gets a bit of a descent in the eyebrows with aging. You want to lift up enough to correct that, but not enough to completely, make it unnatural. So it's a good idea to lift up a very small amount, but not too much on there. That is the first one. The next one is for underarm sweating, otherwise known as hyperhidrosis. About 10 injections in each armpit. Sounds very painful, but it's actually not too bad. That will reduce sweating for a period of about 6 months. The next one is Botox for a gummy smile. So the muscle that pulls up on the nose here, that muscle, in some people it's a little bit stronger, so it means the top lip becomes very thin when you smile. So a little bit of Botox here and here will cancel that out and will mean that you don't have a gummy smile. So that's a pretty easy one. The next one would be bunny lines. This one's quite important if you're treating around the eyes, because sometimes getting rid of lines on the sides of the eyes, they just kind of move into the center. So a little bit of Botox on here can make sure that the treatment is undetectable and it remains natural. Under eye lines, it's kind of the same as treating the bunny lines, but it's actually just underneath your eyes. So some people have a strong muscle that pulls in this way, which can cause lines going here or lines going there. So that's another area where you can have treatment. The next one is chin line. In the lower face, there are depressor muscles that pull the side of the mouth down, which can cause a turn down in the side of the mouth. The next area is the mentalis. This muscle pulls upwards and can create a line across here. So those two work well together. There are two more. One is across the top lip. Some Botox in there can get rid of smoker's lines. And then finally, using Botox on the jaw can narrow the jaw. So this treatment is quite popular in women who have a wider jaw. A lot of Asian ladies would get that treatment done, and it just narrows in this area here. So there's some of the advanced areas of Botox. I hope this has been helpful. I'm Dr. Paul from Amara Aesthetics. Talk to you next time.